All right, good morning, everyone. I say this every year, but if I could just bottle this day, someone serenades you to wake you up, has a healthy breakfast all ready for you. If I could bottle that and have it every day of my life, that would be perfect. I love this day. Unfortunately, it's only once a year, so maybe we can speed that up and have it more than once a year because I love this day. Again, I'm Kelly Eckerman from KMBC TV. And on behalf of KMBC, I want to tell you how proud we are to sponsor this event every year. And we're so glad that you decided to be part of Living in Vitality. We support the goal of LIVE, which is empowering women for life. And I look forward to this event because when I look out at your faces, it's so refreshing to see that each and every one of you decided to take time out of your day to do something for yourself. Throughout the year, I talk to people who say, yeah, this is the thing, this is the day I carve out to go with my best friend or take my mom or go with a coworker. I know so often it's hard to make time for yourself because you're so worried about everybody else, but I really, really hope you take advantage of today and all that it has to offer. Take time for yourself, do all the things, take advantage of the booths, the breakout seminars, and I guarantee you, make it to the keynote speeches today. The one you're about to hear this morning, the one set for the luncheon, I guarantee it's going to change your day and it's going to give you a boost into the rest of the year. My main job today really is to get you from point A to point B, kind of give you some housekeeping notes, let you know what's coming next. And as many of you know, we give away great door prizes at this event. So just to tempt you, one of them, well, there are actually two 200 gift cards from Macy's. A 2017 Cannondale Women's 4A4 bike. The retail for that, $440. That's from CBiz and CBiz Women's Advantage. There's a healthy gift basket with copies of today's keynote books. That's coming from Commerce Bank. And a 3-month unlimited Sunlighten purifying treatment. That's valued at $750, and that's coming to us from Sunlight Day Spa. And stick around because this afternoon, at the end of the day, we're going to give away a Seasons 52 chef-presented dinner for 8, and that is paired with a night stay at the Intercontinental on the Plaza. Also, okay, I hate to say this, but I don't have it. There is a stunning 14-karat gold piece of jewelry, a necklace. It's a pendant that is worth $1,325. That was donated by Van Brock Jewelry, and I promise I'm going to get it. They carry it around in a briefcase because it's so valuable, and they don't want me to lose it, and so now, of course, I've lost it. I don't know where it is. But we will show that to you. That's one of the other fun gifts that they'll be giving away today. But you do have to be present to win, but I know you will be, so I'm not worried about that. Also, and we're hoping that you'll take advantage of this. I've been doing a little of this myself. Tweet about today's event, share it with everyone. That's what makes this a sold-out event every year is because everybody keeps talking about it. If you'd like to tweet, the Twitter handle is @SMMCKC. The hashtag for today is #LiveKC, that's LIVKC. Or you can visit facebook.com/Shawnee Mission, upload photos, make comments on today's event, and one more enticement for that is that they're going to select one person who has posted on the Facebook page or tweeted about the event, and you'll get a $200 Macy's gift card as well, so a little motivation there as well. And we ask this every year, is that you fill out your survey card. It's in the front pocket of your program. If you fill it out, you'll get a free rose from Dr. Barbara McGrath. That's one thing about it. The other thing is they really take your comments seriously. That's why this event just gets better every year, because you tell us what you'd like to see, and they accommodate. And that's why every event gets better and better because of your comments. So please take time to do that. All of us at KMBC are really excited about what I'm about to bring you. We got to sponsor this morning's keynote speaker. You've seen her on GMA all week. She was actually on our newscast last night, so I got to meet her. She's dynamic, she's talented, she's a health professional, she's a really important person, part of the ABC News team. Of course, I'm talking about Dr. Jennifer Ashton. She is a leading voice in women's health today. She is board certified in OBGYN and obesity medicine. She's just received her master's in nutrition from Columbia University. Dr. Ashton is the chief women's health correspondent for ABC News. She is the senior medical contributor for Good Morning America, and she's the chief women's health contributor for the Dr. Oz Show. She also has her own practice. It seems like she's two people, doesn't it? She is known for her girlfriend's approachable demeanor. She has Ivy League credentials. She's committed to improving the lives of women through increasing health literacy while debunking all those medical myths. She's the author of 3 books, and including her latest book, which is Eat This, Not That When You're Expecting, which was released in mid-May. It is an honor for me at this point to introduce our speaker today. A warm welcome for Dr. Jennifer Ashton.
Thank you, my dear. Good morning, you guys. Kansas City, it's so nice to see so many familiar faces from last night, especially my new BFF, Sarah Smith, the general manager of KMBC. Thank you for coming, and Olivia. And it's so great to see so many of you here bright and early, all for Vitality. So this is a big luxury for me because if you are familiar with our segments on Good Morning America, most of you know that if you go to refill your coffee cup, you'll miss my entire segment. A long segment on GMA is maybe 2 minutes. Most of them are 1:15. So for me to get to speak with you for almost an hour is truly a gift. And I hope my goal for you is that you leave with at least one, hopefully a lot more, things that you can start to do today, not just in your life, but in your own circle that can really improve your vitality. So, already we're having technical issues. Perfect. So I thought that this was a good place to start. I'm a very visual person. I don't want you to be bored looking at me for 45 minutes, so hopefully you'll enjoy some of our visuals. But a good place to start with the whole day is really with the definition of the word vitality. You'll see here that it is a noun, the state of being strong and active, energy, life, spirit, bounce, fire, drive. I love the synonyms, and I think maybe we could start using them, except since we're in a big ballroom, we don't want to say fire. But I think that when you think of these terms, hopefully you will start to bring this into the way that you think about what we're going to talk about. So the way that we're going to go through this is really chronologically as we go through life, and we're going to take it by decade. Starting with the teenage years. This picture was taken a few years ago when my daughter and I were visiting Boston. We did a duck tour. I made a real fool out of myself with that beak. And that's my daughter, Chloe. You'll see her throughout the talk. But when you talk about the teenage years today, I guarantee every single person in this room, when we think back to when we were teenagers, life today bears no resemblance to what we experienced. And that really is true medically, physically, socially, environmentally. Things are completely different today. And while we probably heard our moms saying that, it really is true today. So when you talk about puberty and when it occurs, the need to really establish a solid foundation both for health and wellness going on throughout a teenager's life, this is an important decade. I don't think there's any question that they're on the fast track today. I want to bring your attention to really the last 2 bulleted points here because I think that these are the jaw droppers. For girls, we know conclusively that Caucasian American girls can have their first menstrual period as early as 12. That's the average age. African American girls, it's age 11. If you back up the clock, puberty can start as early as 9. Now, a lot of parents see that and they freak out and they think something's wrong. What do I do? They go to the pediatrician. Sometimes they go to an adolescent gynecologist like myself. We don't really understand why that happens today. Part of it, of course, could be obesity because fat produces estrogen. Part of it could be those obesogens in our environment and chemicals and hormones. The bottom line is when you talk about a 9-year-old girl or an 8-year-old girl developing hair and breasts, her body might be going through that change, but her mind is certainly not ready to become a teenager. And when you talk about the mind and accelerate through that teenage decade, judgment, risk-taking, which is all normal teenage behavior, that's what teens are supposed to do. But in terms of maturity and executive function, which goes on in the frontal lobe in the brain, that's not even mature until mid-20s, or in my case, never. Um, some adults never develop their frontal lobe. So there's a disconnect, right? We have to be mindful of that, especially when we're talking about teenage girls. Here's another picture of Chloe, my daughter, more recently. That picture was taken in the last year. She's 16 and a half years old. She is an elite ice hockey player. She plays at the national level. She's one tough, savage beast, and I love it. And I picked this picture because, are there any hockey moms in the room, by the way? Yes, I love it. So I'm going into a weekend up in Boston right now where I'm going to watch her play 3 games at Harvard, so I'm super excited. But I always say hockey, and in fact all sports, I think, are really a metaphor for life. And mind you, I never played ice hockey, but I talk as if I did. In ice hockey, when you make a turn, you're supposed to have your head up looking into the turn. And I think that's a really appropriate metaphor and analogy for life. It's not just about looking at where we are today, it's about looking down the road into our future. And boy, she's got great form in that picture. So I think these are really the big problems facing teenagers today, and especially teenage girls. Yes, nutrition, obesity, incredibly important. We hear about it all the time. It's really only getting worse. Their risk-taking behaviors and how that interacts with their access to social media. You know, again, when we were teenagers, we would flirt with some guy or whatever. That was one-on-one. Now they flirt with a guy online. That could be a 50-year-old. That could be 10 guys. That could be 10,000 guys. It's much different. Mental illness we don't hear enough about, either in the medical community or in the media. It's a big problem. There are a lot of teenagers today who have clinical diagnosis of anxiety, depression, eating disorders. There are many more teens that are undiagnosed, and this is a significant problem. And of course, bullying, we hear about it. We are tempted to say, oh, when I was in school, there was the class bully. Again, the social media magnifies that problem. So what are the solutions? I think the key thing is to start early. When we talk about puberty and a 9-year-old, what does that mean? If you wait to have that talk with your daughter or granddaughter or student till she's in high school, it's too late. So if they're going to be having their first period at age 11 and starting puberty at age 9, we need to start having this conversation with them practically when they're in diapers. And it sounds ridiculous, but it really is true. I think the need to identify a role model, that cannot be overemphasized. Look who our role models are today for our teenage girls and our young girls. They start with a K, the Kardashian clan. Great, they're great businesswomen, right? But when I had to tell my daughter why Kim Kardashian became famous in the first place, do most people know? Sex tape. Isn't that impressive? You know, I think I was grabbing the steering wheel and she goes, why is she famous anyway, Mom? And I had swerved off the road. I think, you know, I put communication on there, but so many of us struggle with that, myself included. I oftentimes will say to my daughter and my son, who's 18 and freshman in college, kids don't come with an owner's manual. I've never had an 18-year-old and a 16-year-old before. And guess what? I'm going to make mistakes. They're going to make mistakes. My goal is to not make mistakes that ruin their lives. And my goal for them is that they don't make mistakes that ruin their lives or someone else's life. And I think that in my office, when I sit with a mom and her daughter, I'll encourage the mom when she says, I don't know how to talk. I don't know how to talk to a 14-year-old. What am I going to say? I don't speak her language. And I'll say, sometimes you don't have to give her the answers. Just ask the questions. Bless you. So I think asking when you don't know what to say is a perfect way to start. And I think we do have to walk the walk, not just talk the talk. You know, any parent or teacher or coach in this room knows it's not enough to just say what you want them to do. You have to actually live like that. I love these inspirational quotes. This is one of my favorite ones, and I actually think this is perfect advice for a teenager. advice from a tree. I've tweeted this, I've Instagrammed it. I'll leave it up so you guys can get some shots. No one drinks enough water, by the way, myself included, so that's, I think, good advice. So going into the 20s, I'm going to read this quote for you guys in the back. It says, "Your 20s are your selfish years. It's a decade to immerse yourself in every single thing possible. Be selfish with your time and all the aspects of you. Tinker with shit, travel, explore, love a lot, love a little, and never touch the ground." And I think that that's really important advice in this decade. I think this is the key decade where even if you think it's so far down the road from a reproductive health standpoint, you do want to start to prepare for pregnancy, and we're going to talk about what that means in a second. And I think this is when, go back to the tree picture that we just saw, you want to start to lay down and establish those good foundation, the good roots. I call it the trifecta of good health, which is for all of us in this room, our bodies need 3 things every single day. It needs rest, it needs fuel, and it needs to move. And I know my friend Sarah Smith, did you work out yet today? Of course you did. I love it. And it needs that every day. So this is the decade where you're starting to work maybe, you're finished with your education maybe, or whatever you're doing. Those are the 3 things that I encourage people to focus on. These are some of the issues that I see a lot in my patients in their 20s. Yes, there's work and relationship stress. Accidents, unfortunately, do happen, but I really want to focus on this fertility window. You're going to be hearing a lot more about this in the news. We're starting to hear a lot about it. We covered a lot on Good Morning America because there's a massive interest in reproductive health and fertility. And let's face it, a lot of that is great news because now a woman in her 20s has the ability, and it will become more accessible, to freeze her eggs. And so the stress of, oh my gosh, the clock is ticking, I'm not in a relationship, I want to start a career, that's hopefully going to be lessened for women of that age when it wasn't really an option for us. A lot of people are setting up what's called fertility testing, which there are pros and cons to medically. What that means is that a woman can basically go into a clinic, go into a doctor's office and say, I'm 25, I'm not in a relationship, I'm not trying to get pregnant, but I want to just have an idea of what my fertility status is. And there are some kind of tests that we can do to look at that, and fertility testing, egg freezing, again, can be very expensive, but as it becomes more widespread and more accessible, of course, the cost will go down, which will be amazing. That's me hanging upside down. So I had to throw this slide in because there's, of course, a story with this picture. This was at a place called Aerial Yoga or Aerial Fit in Los Angeles. It was during the big nor'easter last year. I was working in LA, and I literally got stranded there, and I had always wanted to try this. This was my first day, and it was unbelievably hard. Sarah, you should try this. You'd love it. But really fun and a little scary, so that, I think, added to the fun in a sick way. I also was recovering from a cold, and it was really not a good idea for me to be upside down, but it was a lot of fun. I put it on there because I want to encourage every single person sitting in here. Remember that motto. Hopefully remember this picture and you'll laugh. Do something you've never done before. That's what life is about, and it's about trusting your body and pushing your body in safe and fun ways, and I think you'll be pleasantly surprised with the results. My solutions for the 20s, this is true for every decade, but particularly to start at this age, be smart about your health. Know your own history. This is a great time to talk to moms, grandmothers, aunts, and say, well, tell me about your pregnancies. Were you ever in the hospital? What surgery did you have? What runs in the family? Before it's too late. While those relatives are still alive. I can't tell you how many women I speak with that I say, so any cancer family history, and they say, yeah, my aunt, she had some kind of female cancer. And I go, any idea what kind? Because it's kind of important. Some are genetically passed along, some aren't. I don't know. And a lot of older generations, way older, didn't talk about that kind of thing. That's important for all of us to know, because your family history is a major contributing factor. Also, I like to recommend that people actually keep their records. That's your information. So when you have a test done, or a biopsy, or a CAT scan, get a copy of that report. It's yours. It's not secret information. So you can keep a folder or scan it into your computer, but you should have that information. And lastly, and I can't emphasize this enough, don't find a doctor that you like, find a doctor that you love. Usually for women, I'm fortunate to say this is the gynecologist, because this is the lifelong relationship that you have throughout your whole life. I can't tell you how many people hate their doctors. You should love your doctor. So put that on your to-do list. It's hard, but it's very, very worthwhile. 30s. Sadly, I'm not in my 30s anymore, but this is my new puppy. He's Mason. He's a Morkie. I'm training him to be a service dog, so he's gonna go into my hospital actually and visit patients. And I was never a small dog person until I had him. Now I'm one of those embarrassing people who has videos on my phone, pictures on my phone. He has his own Instagram account, _Mason the Morkie. I just love him. Anyone who has a little dog, I know, I'm with you. I'm one of you now. Okay, so decade of the 30s. This is when most women are having at least one pregnancy if they're gonna choose to have babies. My latest book, which is up there, Eat This, Not That When You're Expecting, I actually found an unexpected kind of use for that book, because there are only 4 million babies born in the country every year, right? So, and a lot of women choose not to ever have a baby. So when I was writing that book, as I was finishing my master's in nutrition, I started to realize that for women who do have babies, it's often the healthiest they ever are when they're pregnant. Why is that? Because women are the most selfless people ever. And we can be super unhealthy for ourselves, but once you put a growing human inside us, we become very careful. I would encourage you at any age, even the men, live like you're pregnant. Live like you're pregnant. You will be surprised what changes you start to make. And if you have been pregnant at one point and you think back to the things you did then, start doing some of them today. You'll be getting more sleep. You'll be getting more exercise. You'll be eating well. You'll be drinking less. You might not be smoking, hopefully. And a lot of that I talk about in my book, I would encourage people to do whether they're pregnant or not. These are some of the big issues that we see especially in women, obviously, when they're in their 30s. A lot of them surround pregnancy. There's been a big push recently with the American Heart Association to recognize the factors as risk factors that reproductive or OBGYN health issues can place on a woman for developing future heart disease. Two of the big ones, gestational diabetes and excessive weight gain during pregnancy. Very, very important issues that not only affect the health of the woman and the fetus she's carrying, but the generation after that fetus. So we call it the grandmother theory. Our nutrition in this country, in my opinion, has never been worse. It is absolutely in critical condition. I'm not an expert on our food industry, but what I do know about it, I'm very troubled by. We have to all do our best. We know, most of us know what we should and should not be eating. I go through a lot of that in all my books, actually, but a good way to think of it, eat from the farm, not the factory. If you look at a label and you can't pronounce the words, you shouldn't be putting it in your body. And if a food that you're eating does not resemble its natural form, probably shouldn't be eating that either. Is that difficult to do? Absolutely. Can it be expensive and time-consuming? Absolutely. But is it worthwhile? 100%. Stress and anxiety are starting to creep in now. You're going to see that obviously through every decade, and I don't think we talk about it enough. Here are some good fixes. We've talked about all these things already. If you haven't done them in your 20s, it's not too late to do them now. Just a show of hands, the people in the room, how many are in your 30s? Nice. All right, so good. So 40s, here we go, preparing for battle. I actually wanted to put the full body armor on, but I stopped with just the bike helmet. Sometimes as a mom, I felt like I needed that helmet on actually all day long. This is what I call, the kind of the halfway mark, usually. Statistically, if a person gets to the age of 65 without heart disease or cancer, as a woman today, your life expectancy is approximately 88 years of age. And that's only getting longer. Yeah, exactly, we should. So this is a decade where you can think of, you're kind of roughly at the halfway mark, and you're going to be transitioning from premenopausal to postmenopausal. When I was showing my friend Nicole this slide, she said, "What's perimenopausal?" And I said, well, some people think that starts at age 20, but really that's just the period of time where we're kind of on the launching pad leading up to menopause. Average age of menopause is 51. Some women start to begin having perimenopausal symptoms as early as 42, 40. Can't blame everything on that, but it is something to keep an eye on. Fear. I can't tell you how many women come into my office, and of all ages, and this is really a staggering concept to wrap your head around, and say, I have anxiety, and I have real anxiety attacks. And I just want to see a show of hands of the people in this room who've had what they consider to be a classic anxiety attack. A good number, right? It's super unpleasant. You literally feel like you're gonna die. Your heart is pounding, you can't breathe, you might be nauseated, sweating, dizzy. It's very, very unpleasant. And there are real physical manifestations of that. We don't understand where or why it happens, but it's common. And I think that one of my theories about this is that you can't live in the world that we live in today and be an aware, thinking, cognizant human being and not have some degree of fear and anxiety about our present and our future. And whether that's a school shooting or our presidential campaign. Just have to take a moment. And especially, by the way, when you're in the media, there's a very interesting phenomenon that happens, and it happens to all of us, whether you're in front of the camera, behind the camera, or watching on your television set at home. When there is a natural disaster or a shooting or a big event like the train crash yesterday, or I covered the shooting in Orlando with ABC, we don't just go through that once. We see it again and again and again and again. And our brain does not know that we're watching the same scene on television thousands of times. Our brain, in the limbic system and the part that registers emotion, thinks, oh my God, it's happening again. Oh my God, it's happening again. And that has consequences. And I think that fear and anxiety and depression are part of the consequences of that. Not to say I want you to turn off your TV, people. I don't want you to turn off your TV. But we have to be aware of that. And when I go to cover a story like the Orlando shooting, and we're trying to tell heroic stories of doctors and nurses who saved lives, it's very bizarre to be front row at a major trauma like that and not feel the emotional and psychological impact that that takes, and it takes it on all of us. So I think one thing to do is acknowledge it, and just say to someone, God, I'm really feeling that. It's hard to watch kids being blown away at school and not be upset by that. I think this is absolutely the appropriate decade where we start to think, oh my God, I'm at the halfway mark. I'm going to die soon. I sound like my mother, but you're not going to die soon when you're in your 40s. I would say, Mom, come on. Really, she's Italian. She's so melodramatic. And also, we're in the sandwich generation, right? So a lot of us have kids, and we have parents, and we're taking care of both of them. I love this saying. I have it on my refrigerator. It's not what you do, it's how you do it. It's not what you see, it's how you look at it. And it's not how your life is, it's how you live it. You know, my friend and colleague Robin Roberts, you probably heard her say that her mom used to say, everyone has something, and make your mess your message. I think we all can follow that. And in medicine, I think that context and perspective is incredibly important. I frequently will have to deliver a diagnosis to someone that generates tears and crying, and not to diminish the impact of that diagnosis, but I will say, as a doctor, you always have to remember that someone has it worse. And that's not to take it away from you, but it's to give you the context and perspective to realize that it's not maybe as bad as it sounds. This is a good friend of mine, Dr. Tiffany Davis Henry. She's a psychologist, and we've worked together in television. She's an amazing person. I just wanted you guys to see her, and she's on Twitter. You guys can follow her too. I think these are some of the fixes for us in our 40s. Really focus on mental health and well-being. We need to get rid of that stigma. You know, I tell people when they have depression, anxiety, yes, do I want you to change your lifestyle to help that? Absolutely. Do I think you should be speaking to a social worker or a psychotherapist or a psychologist? Absolutely. But if you need medication, there is no shame in that game. It's 2016. If you have high blood pressure, you treat it. If you have depression or anxiety, you should treat it. And I think the faster we get rid of that mental stigma, the better. And we obviously need to focus more on mental health and well-being. I put dump the toxic stressors on there because I think we need to know when to hit the purge valve. If someone is not working well in your life or something, bye. Life's too short. Don't try to fix everything. Just take a nice objective assessment and say, this is not working for me. Doesn't mean we have to do it in a violent or nasty way, but just very, very rational. I think listening to your body is incredibly important. We don't know everything in medicine. No doctor does. The second you hear a doctor who says that he or she knows everything is when you should run, not walk, for the door. And I give a lot of credence to people when they say something doesn't feel right. So be more aware of your body, but at the same time, we have a saying in medicine that I love. When you hear hooves outside the door, think horses, not zebras. So now, doctors, by the way, I will admit, we are the worst at this. We are such panic mongers you can't even imagine. If I feel a little bump behind my ear, I'm like, oh my God, I have metastatic brain cancer. And in fact, my soon-to-be ex-husband, who we're very, very close and very amicable, he's a cardiothoracic surgeon, and true story, several times in our 20 years together, I went to him and said, I'm fairly confident I have pancreatic or esophageal cancer. And I have pain here, it's radiating to my back, I've had it for 2 weeks. And he goes, oh, 2 weeks? Well, you probably have 6 weeks left max, so I wouldn't, just don't do anything. And I said, no, I'm serious. And he goes, all right, what about the Motrin you've been taking? You think that could give you a little gastritis, heartburn? I said, probably. So he said, I have an idea. Why don't you take a week of Pepsid? If you're still alive, after that, we could maybe talk about what's going on. So I did it. And when I walk away from these kind of conversations with him, I always go, God, I hate when you're right. I hate when you're right. So I took the Pepsid. 2 weeks later, he didn't even ask me after a week. I think maybe he was hoping that he could get rid of me. But 2 weeks later, he said, how's your cancer? I said, you're not going to believe this, but it's gone. You were right. And he said, that is amazing. You should write that up because you just cured end-stage pancreatic and esophageal cancer with Pepsid in a week. It's amazing. But so we do it, okay? Doctors are the worst. We are the worst. And another time I thought I had ovarian, cervical, uterine cancer all at the same time with a touch of melanoma. I did. I survived that one too. And so that saying, when you hear hooves, think horses, not zebras, means common things happen commonly. Nothing bad ever goes away on its own, even my cancer. And you should have faith in the power of your body, but at the same time, you should listen to it. And when something doesn't feel right to you, you should let someone know. This is one of my favorite pictures. Has anyone in here ever walked a labyrinth? Oh, isn't it amazing? Okay, so this is a picture taken in the Berkshires in Massachusetts. That's me right there in the middle, walking a stone labyrinth. Labyrinths, and I've done 3, I think now, every time I can't even explain to you the emotional feeling that I get as I'm doing it and immediately afterwards. It really also is supposed to be a metaphor for life. And you're supposed to do it silently. The first time I did it was with a group of women, and when they said, walk it silently, that was like asking us not to breathe. But we did it, and half of us came out in tears because you realize as you walk in, you can't see the center when you start, right? Was that your guys' experience too? When you enter the path, you actually can't with your eye trace how you get to the center. And so you follow that path, and of course, because you have to do it silently, you are forced to awaken your other senses and to really think and look, and you'll notice passing another person if someone is coming out. How do you pass a person in a labyrinth? Do you make eye contact? Do you step aside? Do they step aside for you? And again, you start to think of the metaphor for life. We're passing each other all the time. Do we look at the people that we come in contact with? So if you ever have an opportunity to do it, I can't recommend it enough. It speaks to, though, our spiritual well-being. I learned to meditate 2 years ago because I thought it was the only part of my wellness routine and a vitality program that I was ignoring. And it was typical type A. If you said to me, okay, you talk about your trifecta, Jen, how do you do it? I go, every night I'm sleeping 7 to 9 hours, I'm exercising almost, 6 days a week, I eat pretty well. Everything was great below the neck. Above the neck, I was tighter, and I'm gonna quote my late grandmother, tighter than a fart in a spacesuit. Thanks, Grandma. Little Italian grandma. I was really, and I didn't even know it. And so I started meditating, and my daughter, after 2 weeks, she said, Mom, I think I want to start to meditate. And I said, you're kidding. What? She was 15 at the time, and she said, I see a huge difference in you. And I said, what do you mean? What kind of difference? And she said, you're so much more relaxed now. And I said, how stressed was I before? She goes, you're pretty tight. You don't have to learn how to meditate. You don't have to take lessons. The way that I was taught was simple transcendental meditation, 20 minutes a day. And you are taught and you know how, and it was amazing. I've never recommended it to a patient who hasn't told me that she sleeps better after she learns. So I think if you haven't done it, please look into it. It was amazing. Fabulous 50s. You probably recognize some of the people in this picture. In the middle is Ariana Huffington, obviously over 50, and my good friend Mehmet Oz. 2 examples of people who are always taking chances. They're always pushing the envelope. They're always raising their bar higher to do more. Never in their vocabulary is, well, I'm over 50. They don't speak that language. And I think they're real inspirations for what they do in terms of bringing awareness to health, wellness, and vitality. Go back to the aerial yoga picture. Take a chance. If you're in your 50s, what are you waiting for? It's never too late. So whether it's doing something physical, social, intellectual, going back to school, job change, anything, do it. I loved this slide, and I apologize that the print isn't clear. One of my patients, who's a judge, put this on Facebook. I mean, it doesn't get better, right? Which one's your favorite? I think then praying for a BMW, now praying for a bowel movement. I think that's really good. Hot guys, hot flash. And sorry for the men in the room, this is obviously female-centric. I love this. But I think that it reminds us, if we can't laugh at ourselves, game over, right? I love this one. Give you guys a sec to snap a pic. But all kidding aside, I think we do have to start looking at ourselves as a society, as a culture, and ask ourselves why we even have to talk about that a woman or a man, 50s, 60s, 70s, why they can't still be vibrant. Why, we see someone and we go, wow, it's amazing. You look so good. You look so young. We're always trying to reset things back, right? Look at the cultures who don't do this. These cultures celebrate and revere aging. Korean, Chinese, Indian, Native American, Greek, not us. We're amazed now when we see someone over the age of 50 or 60 or 70 who is still amazing, and I don't think it should be that way. As we wind up, I really want to talk about something that everyone in this room, I want you to remember this name, this medication, metformin. You are going to be hearing about this in the next couple of years as possibly the key to anti-aging or longevity. This is a medication that has been around for over 20 years. In the field of OBGYN, we give it to pregnant women. It tells you how safe we think it is. It's really for type 2 diabetics. That's how it was brought to market. It is not insulin, but it helps your body use glucose that we get from our food as fuel rather than store it as fat. Like many other medications and drugs, it was discovered that it had all these other benefits. Some weight loss, some cancer risk reduction, now maybe some cognitive or brain protection. So, late 2015, the FDA actually approved the first anti-aging trial studying this medication. Now, whenever you talk about a prescription medication, and this is part of my mantra, both on the air and in my office, you have to ask yourself 4 questions. What are the risks of taking it? What are the risks of not taking it? What are the benefits of taking it? And what are the benefits of not taking it? And what are the options and alternatives? And I want to be crystal clear, I am not a drug pusher. I would rather see someone on less medications or no medications rather than more. But I want you to know about this particular medication because people in the know, not just in the world of obesity medicine, but in all of the labs at Harvard and on the West Coast and Stanford that are studying longevity and anti-aging are real excited about this pill and this medication. It's safe, it's cheap, there are very minimal side effects, and one study in particular found that 54% of all people taking this medication, those taking it had a 54% lower incidence of any type of cancer. In animal studies, it has increased the lifespan by 20%. So next time I give this talk, maybe we'll be talking about 80s, 90s, 100s, but you will be hearing more and more about this medication. 60s and beyond, we've alluded to this. 60 is the new 50, 70 is the new 60. I met women last night, some of them are here, who, I mean, sign me up if that's what their age looks like. They look amazing. They are amazing. I think that this is the best time in many ways to be a woman, to assess your vitality on a regular basis, just as you assess your finances. And so when you look at how much money you have, how much you're earning, how much you're spending, take a look at your lifestyle the same way and say, what are my risks? What's working well? What do I need to work on? Everyone has to work on something. And remember that statistically, heart disease is our #1 killer. Lung cancer is the #1 cancer killer of women. You have to know those facts, not because it'll happen to you, because those are the statistics that we have to deal with and try to navigate. I just want to close with something new, again, that I think that many in this room probably have not heard of. You may have read things in magazines about this new term, vaginal rejuvenation. As a gynecologist, I had a real skeptical opinion of this when I started to hear it. I thought, oh, dear Lord, what else do we need to rejuvenate? I mean, I need to rejuvenate my toenails, my hair. It's such a project. But as I learned more about it and as the technology and the science has advanced, I started to get super excited about this for my patients, for women everywhere, and eventually for myself. There are a lot of different ways to do it. I like a technique called Thermiva. This came from actually plastic surgeons and dermatologists. They use temperature-controlled radio frequency energy, so the same thing that tightens up our face, real nice, stimulates collagen production. They started to think, wow, if it works on the face, what would it do in the vagina? Now, why would you need that? But all kidding aside, after childbirth, after menopause, once you lose estrogen in your body, loss of estrogen in the genital tract results in a very sensitive, fragile, painful, unhappy vagina. And it can cause a plethora of issues, functional problems for women that go beyond this. This is just a functional problem in my own mind that every time I look in the mirror, things are starting to fall. But if you have those symptoms vaginally, what kind of issues can you see? Overactive bladder, some prolapse where the uterus or the bladder kind of hangs down a little bit, an increased propensity for certain types of vaginal infections or bladder infections, painful intercourse. Those are real issues. So whereas I took the term rejuvenation as kind of like a fluffy, oh, whatever, thing, those issues are no joke. And they affect women's lives and the men in their lives, and it's important. And as I said, mental health, 2016, Viagra has been on the market since the 80s. We deserve something to make our vaginas happy. And this is one way that's non-hormonal and non-surgical that for a lot of women, it can happen. I had a patient in her 70s that I did the procedure on. And I said, you know what, good for you. She came into my office and said, I'm thinking of some kind of plastic surgery. And I said, great, I'm all for that. My brother is chief of plastic surgery at a big medical center in New York City. I am a big believer in if you don't like something about yourself and it's in your power to fix it, right? Whether it's hair color, nose, boobs, I'm all for it. If you can afford it and you want to fix it, fix it. So she said, well, what should I do though? There are so many options. So we started working at the head and we went down. And she said, what about a tummy tuck? And I said, what about your vagina? And she said, you know what? I said, I think the eyelid surgery is the best operation in plastic surgery. It's painless. Trust me, my mother had it done. It gives you a lot of bang for the buck, and it's a quick recovery. I said, why don't you do that and this? And that's what she wound up doing. And I just thought, you know what, good for you. And good for her that she's putting herself first. We do have to remember, though, brain health is important. And most things that are good for the body are good for the brain. And cognitive decline, Alzheimer's disease, is a very significant problem. And you want to start thinking about ways to prevent that as early as possible. I want to thank you guys so much. And I put this picture on here because these are two women enlisted in the Army that I met at a service station in New Jersey. My father was a captain in the US Air Force. I don't think we can thank our servicemen and women enough for what they do for us, but I want to thank you for coming, and I'm happy to take any questions now. You're coming up, right, Cal? We're going to sit, right? We're going to have a coffee clutch?
Yes.
Okay.
I think we get to sit for this part of it. Thank you so much, Dr. Ashton. I wish I could let each and every one of you ask your own personal questions, but since we're limited on time, I'm just going to throw a couple questions at her. We can go ahead and sit, I think.
Should we sit?
Yeah, let's go ahead and sit. First of all, I do need to tell you that several people were passing me notes while I was over there. Since you said find a doctor you love, half the audience would like to know if you're taking new patients.
You know, I love Kansas City. So how do you do that? I mean, some might say it's easier said than done. A couple of suggestions. Ask a nurse. If you know a nurse, they know. They know who the good doctors are. I think a lot of times when my patients relocate and they say, how am I supposed to find a doctor in whatever city, I'll say, here's what you do. Call the biggest hospital or the closest hospital, call labor and delivery, ask to speak to one of the nurses and say, give me 3 OBGYNs that you think are good. They really are a source of great information. That being said, I consider myself truly blessed to have patients from all over the world. Canada, Costa Rica, Europe. It's that important to people that you have someone who knows you as a person, not as a body part, and who is going to be there through sickness and health, maybe even longer than a spouse. So I would encourage people to really make it a mission. Talk to friends, talk to other doctors. You know, sometimes I'll say, you want to go to the doctor's doctor, because we know like who the smart people are. Those are three tips that I would say.
Yeah, and it's a long-term relationship, as you said. So yeah, and sometimes when I've known doctors as a health reporter for so long here, I'll ask them who their wife sees or who they send their wife to, because I figure too that's a pretty good statement for them. One thing, because many of us wish we could turn to you for advice every day. If there was one overwhelming thing that you wish you could tell every woman to help us get through all these struggles, what is it you wish you could say to every woman?
God, one thing, Kelly. I think if I had to pick one thing, it's try to understand how your body works. Now, I don't mean understand like a doctor or a nurse or a midwife does, but the basics. So try, as if you were almost explaining to a child. So let's take a GYN exam, a pap smear. Do you know what a pap smear checks for? Do you know what body part that is? Do you know what it looks like? Do you know what the results are? You know, one of my pet peeves is when patients have abnormal pap smears and they come to me for a second opinion and they say, my pap was abnormal. I say, abnormal is not on the lab report. What type of abnormality? So the more questions you ask, the more you will be informed, and the more well-informed you are, the better. So this isn't a mystery. Everyone has a body, and you should know how it works. And if you start to think like that, I always tell people when I'm on the air, my goal is not to teach you a fact, because that fact can change tomorrow. My real goal is to teach you how to think like a doctor, because I think that's where you'll get the best help.
Ask great questions.
Yeah.
Okay, you brought this up several times as you talked. I don't know how many times people say, you know, women want to take care of everyone. Yeah. No matter what, no matter how many times people say take care of yourself first, you feel like if you don't take care of everybody, who will?
Right.
I'm guessing you went into that a lot, and you talked a lot about anxiety and stress. How do you help your patients deal with that?
Putting themselves first. So if you were a fly on the wall with my conversation with Sarah Smith last night at the restaurant, and I said, we are twins separated at birth, because Sarah articulated exactly what I say in my office, on the air, in my books, that we completely need a paradigm shift here. Let's talk about the trifecta of health that we mentioned. How many people say, I don't get 7 to 9 hours of sleep because I don't have time? Why? What's going to happen if you don't? Nothing, right? So here's what I tell people. This isn't about being selfish, it's self-care. And every woman in this room, I don't care whether you're a mother, a grandmother, a boss, a supervisor, a manager, you are, whether you know it or not, the hub of your circle. If something happens to you, that wheel is coming off. And so when I say I get 7 to 9 hours of sleep every single night and people don't believe me, I say 2 things. Number 1, no one's going to die if the dishwasher is not unloaded or loaded. It's just whatever is not done by the time I need to get 7 to 9 hours doesn't get done that day. And I have 0 guilt about that. So that's one thing. And the other thing is that I know that I am not efficient at my job the next day if I don't get that sleep. And I can't be responsible for people's lives, be speaking to 5 million people a day on Good Morning America, and not be firing. I need every molecule of brain power that I have, trust me. I cannot afford to be like on 2 hours of sleep going, I can't. And my kids know I'm a real cranky bitch if I don't get my sleep, my exercise. They do not play when, and what is that doing? That's teaching them, both my son and my daughter, that those things are important. So I think that we hear it all the time, but we just don't do it. Trust me, start doing it today and see how you feel in a week. And tweet me, oh, guess what? I'm getting 7 hours. You're not going to believe it. I feel so much better. You will. I can promise you. So I think that, we can't think of it as selfish. It's self-care.
Okay, I know we don't have a lot more time, but one practical question. When can we start asking for metformin?
Okay, so one, I'm a real medical science geek, and I wanted everyone here to know about something that's so cutting edge that hopefully you'll remember me when you start hearing about it on Good Morning America, et cetera, et cetera. To be perfectly honest, not every doctor, if you walk into your doctor's office and they say, you want what? No, I'm not doing that. Because I've been in that position, right? And our first premise in medicine is do no harm. And if they're not in the obesity medicine world, or they don't know about that FDA trial, which by the way was national news, if you Google it, you're gonna see it, it's not a secret, they might be hesitant to give it. And I think we do have to temper all the optimism and excitement about metformin and realize that it's not for everyone. Not everyone in the world should be on a prescription medication, but for some people, under the supervision of their healthcare provider, it comes down to risk-benefit. What are the risks? What are the benefits? And does that healthcare provider think, are they comfortable with giving it a try? I will tell you that in my practice, the answer to that is yes, but not every doctor is going to feel that way. And I respect that. That's fine. But I did want you to know about it because in 1 year, 3 years, 5 years, you're going to be hearing a lot more about that.
And that's what we wondered about the timetable. And if we were going to get that reaction, we walked in and started talking about it.
Well, already in the obesity, I just want to say one important thing about obesity management and weight management. When I got board certified in obesity medicine, I will tell you, and I used to pride myself on being a physician that really spent a lot of time talking to my patients about their weight in a way that was not judgmental, not nasty, but before I had to learn everything that I had to learn to get those credentials, deep inside I thought, look, if you're obese or overweight, it's thermodynamics, calories in versus calories out. And I want to just take 1 minute. I know we're short on time, but this is so important. We know now in the obesity medicine world that so many issues go into causing the conditions of overweight and obesity that it is not, 1,000% not, as simple as willpower, control, motivation, anti-laziness. These are neurohormonal signals that come from the brain that trigger a big problem in people's bodies, and there are millions of overweight and obese people walking around thinking that they're a failure, they're lazy, they don't have motivation. None of those things are true. And until they see a physician who knows that it's not as simple as eating carrot sticks, they're going to be trapped in that chronic condition, which is life-threatening. So the pyramid, and if I were just giving a talk on weight, you would have seen this first slide, is at the bottom, everyone has to work on what they eat and how they move. And I don't call it diet and exercise, I call it food and fitness, because I just think it sounds better. In the middle, there's medication, and those are safe, FDA-approved medications to help people lose weight and manage their weight. And at the top is bariatric surgery, which really should be reserved for a few, and I've done research in that field. It can be life-saving, but that's for, you should not have to get to that point. So until we start looking at overweight and obesity like a medical condition, which it is, and realize that someone is not overweight and obese because they're lazy or lack motivation or willpower, we're never going to fix the problem. And I'm never going to write a prescription for an FDA-approved weight loss medication and then tell someone to go have a Big Mac. You're not going to hear those words come out of my mouth. But it's not as simple as just eat better. We know that, and the science supports that. And so many doctors are unaware of that, and so many food, nutrition, diet trainers will say, I've got the fix. I can help you lose weight. Anyone can lose weight in the short term, but at the 2-year mark, the reason that 90%, not everyone, but 90% regain it is because it's not only about what they eat and how they move. This is a true hormonal metabolic problem that needs to be attacked from all angles. And I think without that understanding and that sympathy, we have millions of people in this country who are in real trouble.
I don't know about you, but I have learned so much. A big thank you
Thanks,
to Dr.
Kelly.
Jennifer
Thank
Ashton.
you. Thank you so much. Thanks, that was great.
Thank you so much.
Thank you, guys.